Okay, guys, here's B for you. Talks about TBIs, traumatic brain injuries. Okay, so we're going to go through those for B. So please join me in presentation B. Older adults who experience a traumatic brain injury, TBI, face a significantly higher risk of developing dementia, up to 69% more within 5 years of the injury. This stark statistic reframes TBI not just as an acute medical event, but as a potential gateway to long term cognitive decline, especially in aging populations. A landmark study published in the Canadian Medical Association Journal analyzed medical data from over 260,000 adults aged 65 and older across a 16-year span, 2004 to 2020. The researchers compared outcomes between those who had experienced a TBI and those who had not, revealing a troubling trajectory. TBIs are not isolated incidents. They ripple outward, reshaping the landscape of aging, caregiving, and public health. The key findings, a closer look. Dementia risks surge by 69% within 5 years of the TBI and remained elevated by 65% or 56% even beyond that window. This suggests that TBIs may accelerate underlying neurodegenerative processes or trigger new ones. Falls are primarily the culprit, responsible for over half of TBIs in older adults. These are often preventable, yet they remain a persistent hazard in homes, care facilities, and public spaces. Women and adults age 60 or 85 are disproportionately affected. Among this group, nearly 1 in 3 will develop dementia following a TBI, highlighting the intersection of age, gender, and vulnerability. Social detriments of health play a crucial role. Individuals from low income neighborhoods or rural communities face higher risk not only of injury but uh, inadequate recovery support. They're also more likely to transition into long term care settings post TBI. Publicly funded home care usage spikes after TBI, reflecting the increase, increased need for rehabilitation, monitoring, and daily assistance. Implications for prevention, equity, and systematic design. This research demands a shift from reactive to proactive care, especially for populations already facing systematic barriers. Fall prevention must be framed as cognitive health prevention. Evidence based interventions like home safety, adult strength and balance programs, e.g., Tai Chi, and describing describing protocols that protocols can dramatically reduce fall risks. Culturally tailored outreach is essential. Older adults in marginalized communities may face language barriers, mistrust, or medical systems, or lacking access to preventative services. Toolkits that reflect cultural norms, caregiving structures, and community wisdom can bridge these gaps. Post TBI care should include cognitive monitoring and dementia risk assessments, even for mild injuries. Clinicians need training to recognize subtle signs of decline and to refer patients to appropriate services early. Policymakers must invest in community infrastructure, from accessible housing to transportation and dignity health literacy to reduce isolation and improve recovery outcomes. A call to co-create. This is a rich opportunity to integrate your expertise in participatory design, myth busting, and culturally responsive frameworks. Imagine a modular toolkit that combines trauma informed fall prevention strategies, post TBI cognitive health checklists for caregivers, community led workshops in rural and underserved areas, evaluation matrix to measure cultural adaptation effectiveness. Such a toolkit could empower caregivers, reduce long term care emissions, and honor the lived experiences of elders, especially African American, indigenous, and immigrant populations, often excluded from mainstream interventions. Would you like to sketch out a framework for this? We could start by mapping out key stockholders, identifying culturally resonant messaging, and designing pilot modules for community testing. Okay. Give me a second, guys. For now, Gator Wellness. Take care, folks.